Picture this. It's 2 a.m. You're tossing and turning, maybe getting up for the third time to hit the bathroom. And you're wondering if this is just getting older or something more serious. What if I told you that some of your everyday nighttime habits could be silently sabotaging your prostate health, increasing inflammation, and even raising your risk for bigger issues down the line? As a doctor who's seen countless men struggle with this, I'm here to reveal. Are you destroying your prostate every night? Stick around because we're breaking down the bad habits, debunking the myths. And I'll share 3 simple nighttime routines that could protect your prostate and help you sleep like a baby. If you're over 50 and this hits home, smash that like button now. Let's dive in and turn things around. Prostate problems aren't rare. 50% of men over 60 deal with benign prostatic hyperplasia, BPH. That enlarged prostate causing frequent urination, discomfort, and disrupted sleep. But here's the kicker. Your nighttime routine plays a huge role. Poor habits can worsen inflammation, lower testosterone, and even link to higher cancer risks. Today, we'll expose those habits, clear up the confusion around sleep myths, and arm you with easy fixes. By the end, you'll have actionable steps to safeguard your health. Sounds good? Let's start with the culprits. First up, those sneaky nighttime habits that might be enlarging your prostate or spiking your risk without you realizing. Let's talk about the big ones, backed by what I've seen in practice and the latest research. Number 1. Downing fluids late at night, especially the wrong kinds. Think coffee, tea, beer, or even too much water before bed. Caffeine and alcohol act as diuretics, making your bladder fill up faster and forcing those midnight bathroom runs. This isn't just annoying, it stresses your prostate, leading to more inflammation and worsening BPH symptoms. One study shows that excessive evening fluids can double your nighttime urination frequency, turning a restful night into a nightmare. Then there's overeating or munching on the wrong foods before bed. Heavy meals, especially red meat or processed stuff high in saturated fats, can ramp up inflammation throughout your body, including the prostate. Eating late disrupts your digestion and sleep, and research links shorter nighttime fasting periods to higher prostate cancer risk. Aim for at least 12 to 13 hours without food overnight for better outcomes. I've had patients who snacked on chips or burgers at 9 p.m. and wondered why their PSA levels were creeping up. It's no coincidence. Poor sleep itself is a major offender. Chronic sleep deprivation, getting less than 6 to 7 hours, triggers systemic inflammation and drops testosterone levels, which are crucial for prostate health. Studies show men with disrupted sleep have a 15 to 20% higher risk of prostate issues, including cancer. Add in stress from scrolling on your phone or watching intense TV, and you're compounding the problem. Blue light messes with melatonin, leading to shallower sleep and more prostate strain. Other habits? Staying sedentary all evening. No light walk after dinner means poorer circulation, which can contribute to prostate enlargement. Or ignoring that urge to pee before bed, letting bacteria build up and risking infections that inflame the prostate. These might seem small, but over time, they add up to big trouble. Let me share a quick story about a patient. Tom, 62 years old. He came in exhausted, peeing every hour at night, prostate swollen. Turns out his routine was a beer with dinner, late-night snacks, and Netflix until midnight. After tweaking those habits, his symptoms dropped dramatically in weeks. Stories like Tom's are common. Simple changes make a world of difference. But wait, there's a lot of misinformation out there about sleep and prostate risks. You might have heard things like sleep doesn't affect cancer, or more sleep is always better. Let's debunk those myths right now so you can separate fact from fiction. Myth number 1. Poor sleep has no link to prostate cancer. Wrong research from the American Cancer Society shows short sleep under 6 hours is tied to higher risks for prostate, breast, and other cancers. A study even found men with poor sleep quality have a 15 to 20% increased risk thanks to messed up circadian rhythms and inflammation. I've seen it. Shift workers or insomniacs often face higher odds. Myth 2. Sleeping too much is harmless or even protective. Not quite. While short sleep is bad, excessively long sleep over 9 to 10 hours might also signal underlying issues and has been linked to increased cancer risks in some studies. Balance is key for 7 to 9 hours of quality rest. Myth 3. Prostate problems from sleep are just for the elderly, or that cancer is always fatal if you sleep poorly. Nope. Risks start earlier and while serious. Prostate cancer has high survival rates with early detection. Sleep issues amplify risk but aren't a death sentence. Another big one. Vasectomies or frequent sex cause prostate cancer. Totally debunked. No solid links there. The truth. Sleep quality matters more than you think, but it's controllable. No need to panic, just adjust. Now that we've cleared the air, you're probably asking, Doc, what can I do tonight to protect my prostate? Great question. I've got 3 easy nighttime routines that are game changers. These are simple, evidence-based, and can start improving your health right away. Routine 1. Master your hydration and eating window. Cut off fluids 2 hours before bed. No caffeine or alcohol after 6 p.m. to avoid bladder overload and nighttime trips. Finish dinner early, aiming for a 12-hour fast overnight, which studies link to lower prostate cancer risk. Pee right before lights out. This reduces inflammation and lets you sleep deeper. Routine 2. Build a prostate-friendly sleep hygiene ritual. Keep a consistent bedtime, dim lights an hour before, and ban screens. Blue light disrupts hormones key to prostate health. Make your room cool, 65-68 degrees Fahrenheit, dark and quiet. Add a quick relaxation technique like deep breathing or reading. This combats sleep deprivation's inflammatory effects. Routine 3. Incorporate gentle evening movement. Try yoga poses or a short walk after dinner. Specific. Ones like a child's pose or legs up the wall can ease pelvic tension and improve circulation to the prostate. Regular activity boosts testosterone and sleep quality, reducing BPH risks. Just 10 to 15 minutes can make a difference, but keep it light to avoid revving up before bed. These routines aren't just theory, they work. Patients report fewer wake-ups, better energy, and even improved checkups. Combine them. Hydrate smart, wind down properly, move a bit. If symptoms persist, see your doc. Could be meds or other treatments needed. Gentlemen, your prostate health is in your hands, or rather, in your nightly choices. Don't let bad habits destroy what you can protect. Start tonight and wake up feeling strong. So, there you have it. The habits harming you, myths busted, and 3 routines to try. Remember, this is general advice. Consult your doctor for personalized care. Now, I want to hear from you. What's one nighttime habit you're changing after this? Drop it in the comments below. Let's support each other. This helped? Like, subscribe, and share with a buddy. Stay healthy out there. See you next time.